Hi, welcome to another episode of Youth Diary. Diabetology is the clinical science of diabetes, its diagnosis, management and follow-up. And to tell more about it, we have Dr. Jaya Krishnan with us. He's a diabetologist at Lakshmi Hospital, Aluva. Hello doctor, welcome to our show.
Hi.
Doctor, can you just tell me what is diabetes and what are the symptoms of diabetes?
Well, diabetes is basically a disease which is characterized by classical features of polyuria, polydipsia, polyphagia. It can affect any age group of an individual. Primarily if it affects children below 10 or 8 or 10 or 15 years of age, we categorize it as type 1, and adults above 30 we categorize it as type 2. But in the present society, we come across children who have got type 2 diabetes mainly because of the present lifestyle. But typically they present with polyuria, polydipsia and polyphagia associated with weight loss. And when a person presents with these symptoms, when we check the person's blood sugar levels, it's pretty high. And then we need to arrive at a diagnosis. But again, we need to categorize it, whether it is type 1 or type 2. So for that, we need to get certain specific tests done. But typically, they present with these classical symptoms of polyuria, polydipsia and polyphagia. And many times it so happens, we diagnose diabetes on a routine examination, on a routine screening, especially in individuals who have got a very high risk, especially a very strong family history of diabetes and other comorbid conditions like obesity and other risk factors like sedentary lifestyle and lack of exercise. So typically they present with polyuria, polydipsia and polyphagia.
Doctor, what is the prevalence of diabetes in our society?
Well, as per some studies, there were about 190 million people worldwide in the year 2003, which is expected to go up to 333 million by 2025. So such high is the prevalence of diabetes, total diabetic population in the world, which is presently only tip of the iceberg. And of this, about 90% are type 2 diabetes, and it's only the rest 10% which form the type 1 and other secondary diabetes.
Okay. Yeah. So doctor, we'll go to the questions.
Yeah.
Hi ma'am, my name is Asitul Tesha. I'm doing my second MBBS. I have the doubt that why teens get diabetes?
Well, diabetes in teens is, in the earlier days we used to think diabetes in teens is primarily because of, we just used to categorize it as type 1 diabetes. If it is diagnosed as type 1, then we need to confirm it by certain test which will say whether it is type 1 or type 2. But of late, there are young individuals, young children who are 10 years and above, who are obese, who have got risk factors, especially family history. They tend to present with type 2 diabetes, which are usually found in individuals who are more than 30, 35 or 40. But typically type 1 is primarily it is immune mediated, it is an autoimmune, and there are many other things like which it's an idiopathic etiology. So type 1 is basically immune mediated and idiopathic. There are teenagers who get type 2 diabetes, which again is because of obesity and insulin resistance.
Okay. Yeah. So the most common diabetes is the type 2?
Type 2, that's right. Okay. The most common is in type 2.
Okay. So doctor, what are the complications of diabetes actually?
Well, by and large, diabetes has got microvascular as well as macrovascular complications. Microvascular mainly includes diabetic retinopathy, diabetic neuropathy, diabetic nephropathy. Diabetic retinopathy primarily involves your fundus, your eyes, your vision. And neuropathy, it involves your peripheral nerves, and nephropathy involves kidneys. And typically, people who have got diabetic retinopathy, they present with, sometimes they say that they've got a blurring of vision, they've got some visual disturbances. Hence, whenever a diabetic patient needs to get his fundus examined at least once in a year on a routine basis, irrespective of whether he has got any visual disturbance or not. And as suggested by the ophthalmologist, if he has got some changes, some fundal changes of diabetes, he needs to review it maybe after 3 months or 6 months. And and a repeated change of the power of the lens can give a clue to the clinician that this person's diabetes is not under control. So whenever we go to the ophthalmologist, they say that first get your sugars done. If a diabetic patient goes to an ophthalmologist, he says first get your sugars controlled, and then you come to me. I'll just alter the power of the lens, because
unless you correct
the sugar levels, the power may not be stable. But that is one aspect of it. And then there are other things like there are micro neovascularization and the retinopathic fundal changes. So we need to get the eyes checked at least once in a year, and then at the same time we need to get the kidney functions done at least once in 6 months, or maybe at least in a year. So we can have the gross renal parameters, especially the blood urea and serum creatinine levels, as well as the microalbumin, which can give us a fair amount of idea how good the renal status is, and we can alter the medications as required. If you monitor the renal functions. And the other aspect of the microvascular complication is a diabetic peripheral neuropathy, where many times the patient says that he has got some kind of a tingling, numbness, or lack of sensation of the lower limbs. So this also is manifold. It is directly proportional to the glycemic control, how good the sugar controls are. So one needs to keep on we can do a simple test examinations to see whether the person's the sensory perceptions at his feet is at the sole of the feet is perfect or not. So a diabetic patient should keep on monitoring and his foot. The foot care is of real importance in a diabetic patient, because the sensation in the sole of the foot for a diabetic patient is many times less compared to a normal individual. So he need to examine his foot, self-examination of the foot regularly, just to see if there are some minor injuries which he probably might not have noticed. So or at least ask his counterpart to get the feet examined, or keep a mirror in front of his sole, and then he can have self-examination. He can see if there are some minor wounds. So these are the microvascular complications which we commonly encounter. Macrovascular complications, of course, atherosclerotic changes and coronary artery disease. These are some of the complications which are associated with diabetes. Stroke is another complication which is again associated with diabetes. Which these are all directly proportional to how good your sugar, your glycemic control is.
That means diabetes affects almost all the organs in the body.
Every organ in the body is affected by diabetes, but it is such a disease. If you control it, you can live with it. You need to understand the disease. You need to accept the disease, and you can have a healthy life. But if your lifestyle is not up to the mark, or if your lifestyle is wayward, I guess probably you'll have a tough time.
Doctor, coming to the treatment part, what are the treatment modalities of diabetes?
See, initially when a person is diagnosed to be a diabetic, we, as I just said earlier, we advise we make him understand the disease, and if it is pretty high, if the sugar levels are very high, any type of diabetes, if the blood sugar level is uncontrollably high, I would personally suggest the person to be on insulin for at least a couple of months, then revert back to oral tablets, and then give him a trial of lifestyle modification. If this is just to curb the glucotoxicity, for example, if the sugar levels are 300, on diagnosis 300, 340, and then he is associated with other symptoms, it is to curb the glucotoxicity, we start on insulin. Now, the advantage of starting insulin, early initiation, advantage of starting insulin on diagnosis is it will preserve the residual beta cells. It will give rest to the beta cells, and then after a couple of months the beta cells regain their ability to produce insulin. You give rest to the beta cells. That's the whole idea of starting insulin initially. Later on, there are many patients whom we have started on insulin initially, and then we have completely stopped the patient of tablets or insulin. They are just on lifestyle modification and diet. That's it. No tablets, no medication, but you have to adhere to diet and exercise. That is, this is for patients with high glucose level on diabetes. But then there are patients who've got impaired fasting glucose. If the sugar levels are about fasting sugar levels are somewhere about 126 and above, and your postprandial somewhere about 170, 180, that is impaired glucose tolerance, you can advise them just plain diet and exercise. That's enough. I mean, keep on monitoring the sugar levels every 2 months or every month as per the patient compliance, and then advise them on the importance of diet and exercise, and that should be okay.
Hi ma'am, I'm Chitra Arvind. I'm doing my second MBBS. I have a simple doubt. What are the different types of diabetes?
Well, primarily, in general, we have type 1 diabetes, type 2 diabetes, some specific types of diabetes, and gestational diabetes. This is a broad classification. Type 1 usually affects children in the age group of it can present from 5 years, 3 years, 10 years of age group, and then up to early teens. And then type 2 diabetes, which is again which usually presents by the age of 35-40. Nowadays we are finding even teenagers getting type 2 diabetes, or maybe even children who are 12-13 years of age getting type 2 diabetes. And there are other specific types of diabetes, which is basically a secondary diabetes, which could be due to many other factors like drugs, or some syndromes like Down syndrome, a lot of syndromes which can cause diabetes. And then there is a category or class called gestational diabetes, which happens only during pregnancy, and then it wanes away immediately after pregnancy. So these are the main type. Generally, we classify diabetes in this way.
Okay. You talked about the gestational diabetes, doctor.
Yeah.
Can you just explain a little more about gestational diabetes?
Gestational diabetes is something which usually presents in ladies who are pregnant, who are they get usually manifest by about 26 to 28 weeks of pregnancy, and we need to get in many patients we need to in all the pregnant ladies immediately at pregnancy or at diagnosis of pregnancy, we screen the patient with a simple oral glucose tolerance test, and once they are diagnosed to be having diabetes, we need to be more stringent in a pregnant lady with diabetes, because normally we say that in a non-pregnant lady we say that fasting sugars of about 115 to 120 is okay, lifestyle modification is okay, and a postprandial of 160, 170 is okay, lifestyle modification is okay. But in a pregnant lady, we need to be more stringent, because we need to keep the fasting sugars below 100, and the postprandial should be somewhere below 140. Postprandial at any given time of the day after any meal, or else there are a lot of chances that they might end up with complications of missed abortion or congenital malformations of the heart. They have other developmental anomalies. So being in gestational diabetes, the glycemic control part has to be extremely taken care of, and we need to be extremely stringent on that. The fasting sugars, no compromise, below 100, postprandial should be below 140, and also insulin is the drug of choice in pregnancy. So what we need to make the patient aware, many times it so happens the patient is always reluctant to accept that she has diabetes, and they are reluctant to take insulin. So once they have a feeling that once they start insulin, it is for life. In fact, that's a misconception, and it is only during pregnancy. So, usually once the pregnancy is over, the sugars drop to almost near normal stages, and post pregnancy, 6 weeks after pregnancy, they need to be screened again with an oral glucose tolerance test, and they need to be advised regarding the lifestyle modification, diet and exercise post pregnancy. If they don't adhere to the normal regular routine lifestyle modification and exercise, there is every chance that they will get a full-blown diabetes. So they need to be extremely careful, and they need, again, for the second pregnancy, they have to be careful with the blood sugar levels, and before getting pregnant the second time, they need to get their HbA1c done levels first before conceiving. Because if the HbA1c is an indicator how good your sugar levels are for the last 3 months. It's the glucose bound to the hemoglobin, so that gives you a fair amount of idea how good your glycemic status is. So every pregnant lady who has diabetes, who has once had gestational diabetes, before she conceives the next time, she needs to undergo a routine blood glucose levels to be checked, and an HbA1c, and a counseling before they attempt a second pregnancy. So if the HbA1c levels are high and they conceive, we would usually suggest them to either terminate the pregnancy, because the A1c level before pregnancy, it needs to be maintained below 7, or at least 6.5 or below 7. If it is above 7, there is every chance that she might go in for an abortion, or maybe they may have some congenital anomaly. So that is the key. The glycemic control and HbA1c is the key. It has to, they have to be stressed on that before we discharge the patient.
Doctor, when we take the diabetic parents,
yeah,
what is the chance of the sibling to have to get?
Well, it's something like this. Some say, doctor, I'm just 30, I've got diabetes, and when we take a history, they say my mother is a diabetic, but she got it when she was 60. Well, this is the nature of this disease. What we find, the trend, especially in type 2 diabetes, if the parent gets it at the age of 50, the child will get it at the age of 30, or it is some 10, 15 or 20 years earlier. Now this person has to be careful, because his child may get it even earlier. Now this is the nature of this is the trend which we find, especially in type 2 diabetes. So if both the parents are diabetic, especially the elder sibling stands a very good chance, at least 80 to 90% chance, if he is not careful. So they have to be screened. So this is one of the guidelines. This is one of the areas. If both the parents are diabetic, the children needs to be screened, especially if they have risk factors like parents' diabetes or obesity, or their irregular lifestyle and food habits.
Okay, Doctor, one more question here. Like, what about this intake of sugar content? I mean, in the sense like excess sugar content in a normal person. What is the chance of them to get a diabetes?
See, it's very unlikely. If a normal person has got a normal sugar intake, that's okay. But then it's primarily because you have it's mainly associated with your sedentary lifestyle, your intake of excess calories. A normal individual, a male needs about 2000 odd calories a day, who doesn't do who's not a manual laborer. I mean to say a person who works normally in his house, and a lady needs to about 1800 or maybe about 2000 calories.
Maybe to say an office person, or
that's it.
Fine, yeah.
So now what happens here is, many times you have in between snacks, you take a samosa. A samosa will cost you 300 calories. So you won't end with one samosa. You will end with couple of 2 or 3 samosas. This is just your snack. You are not skipping your meal or anything. You take a parota which is about 320 calories. One single parota will cost you 320 calories. So you don't stop with 320 calories. I mean, one parota, you have 2 or 3. This is only for a meal. You've got other meals to go on. So this intake, this excess of carb intake is converted to sugars, and there is this is where we mess up with the diet and the lack of exercise. So in a diabetic patient, the ADA guidelines just says you need about 150 minutes of brisk walking a day, which gives you a good control of your sugars. That makes it of an average of 20 to 25 minutes a day, which normally many people don't do. So it's basically your lifestyle, your eating of excess calories of food, the junk food. This is what causes the risk, increases the risk for developing diabetes.
So doctor, you've explained very well about the diabetes, its management and
Yeah.
complication. Thank you so much.
Thank you very much.
So guys, if you have any doubts, please write to us. Our email ID is youthdiaryrosebowl@gmail.com. See you next week.